cancer developing in uterus, female organ is called uterine cancer. So any alteration in DNA of uterus leads to tumor, which is called cancer. So uterine cancer happens because of the imbalance between the two hormones, estrogen and progesterone. When there is excess estrogen, these patients are likely to have uterine cancer. So most common is when estrogen is very high, like in female which have early menses, start of menses, and late menopause. Menses starting before age of 12 years and menses continuing after age of 50 years, it becomes a risk factor. If patients is not having any children, it becomes a factor for developing the uterine cancer, because then there is no opposition to estrogen hormone. There are some factors like polycystic ovarian disease, which can cause high estrogen level, which promotes to the uterine cancer. Obesity leads to more estrogen. It again causes imbalance between estrogen and progesterone. The fat cells, they get converted to estrogen, and that fatty acid. That's why they have high chances of developing uterine cancer. And there are certain genetic factors like Lean syndrome, where patient develop uterus cancer along with colon cancer. So genetic predisposition is around 4 to 5% patients. These are the most common causes of uterine cancer, which we see regularly. Any vaginal bleeding post menopause, it becomes a very important factor. Bleeding in between menses and pelvic pain. These are three risk factors which we see. Generally, postmenopausal bleeding is considered to be most important symptom of uterine cancer, and these patients, they will generally develop bleeding is the first symptom and it is early symptom. So if postmenopausal bleeding is present, mostly these patients are in early stages, and if this is not neglected, you can detect in early stage, you can cure it completely. So bleeding, back pain, these are two important two important symptoms of uterine cancer. When there is excess estrogen in the body, it will cause a uterine cancer incidence to be very high. So polycystic ovary disease, it is a risk factor. Obesity becomes a risk factor for uterine cancer. Excess amount of estrogen through oral contraceptive pills. Some oral contraceptive pills contain only estrogen, so it is always to be avoided. You should always take a combination of estrogen and progesterone for a proper prevention. And any genetic alteration is present, like Lean syndrome, BRCA patients, they also have higher chances of developing uterine cancer apart from breast and ovary cancer. Some tumors are there which secrete estrogen, the ovarian tumors, and this estrogen can also cause development of uterine cancer. So these are the main risk factors for developing uterine cancer. When postmenopausal bleeding is present, the first and most important test is to do either sonography to identify endometrial thickness. Normal endometrial thickness is around 6 to 8. If it is increasing, then you should take it very seriously. So in this patient, then the histological examination is done by either DNC, dilatation and curettage, to remove the scraping of the inner wall of the uterus, to remove the cells and check it for examination. And if you want to be more specific, then you can do a hysteroscopy. You can put a small scope in the uterus and examine the abdominal areas, where you can take biopsy guided under the hysteroscope through that abnormal areas. It gives more chances of correctness. And if DNC is showing tumor, then you can proceed with further staging and other procedures. So first thing is suspect, you do your sonography. If sonography is suspicious, you can do DNC or hysteroscopic biopsy. You have to combine it with some scanning. Most common scan done is MRI scan, where you can identify up to which layer the tumor is restricted to. And if it is involving more than myometrium, then you can do PET scan also to identify whether it has spread to the lymph node, spread to other organs. So it becomes a complete staging for uterine cancer. Generally, uterine cancer patients are obese and diabetic. So, for them, when tumor is restricted to uterus or just spread to lymph nodes, which we remove the uterus and the lymph nodes by either laparoscopy or robotic surgery. It's called radical hysterectomy, type 1 radical hysterectomy with lymphadenectomy, where we remove the pelvic lower lymph nodes also and para-aortic upper lymph node also for a proper staging, and would send it for examination. 90% uterine cancer patients are stage 1 cancers. They are diagnosed in stage 1 because they have postmenopausal bleeding and then they consult doctor immediately. So in these patients, surgery becomes the most important thing. Unfortunately, around 10% patients which we see, which where disease is already spread outside, chemotherapy is given to control the tumor cells. So chemotherapy is a palliative treatment, is not a curative, but we give it to control the tumor cells to decrease bleeding. Some patients also respond very well to hormonal therapy. As I told you, estrogen is risk factor for developing uterine cancer, but progesterone is the other hormone which is protective. So if high dose progesterone is given, the cancer cells reverse their biology, and that's why hormone therapy in the form of progesterone injection become also very important to downstream the disease and treat it properly. Again, uterine cancer, there is no actual screening method to detect it early stage, but the most important is any patient with postmenopausal bleeding, even one or two episodes, even spotting also, it should be taken very, very seriously, and you immediately check by either sonography or MRI scan to identify uterus status. It becomes important. So in symptomatic patients only, you do sonography and other tests to identify tumor cells. Otherwise, there is no clear-cut screening test for uterine cancer. So the key is postmenopausal bleeding, consult your doctor immediately.